Every 3 minutes, somewhere in this country, a family sits in a doctor's office and hears words that change everything. Words like early-stage dementia. Words like cognitive decline. Words like, there is nothing we can do. And for most of those families, the assumption is the same. It is age. It is just what happens. It is inevitable. But what if it is not? What if the very pills sitting on your nightstand right now, the ones your doctor told you were safe, the ones you have been swallowing without question for years, are doing something to your brain that nobody ever warned you about? I am DR.Michonne, and in my years of working with adults over 60, one pattern has come up again and again that keeps me up at night. It is not a new virus. It is not a new disease. It is something hiding in plain sight inside medicine cabinets across the country. Research published as recently as 2023 has confirmed that certain medications prescribed every single day to millions of older adults, can increase dementia risk by nearly 50%. Some can shrink memory centers in the brain by more than a quarter within 12 months. Let that number sit with you for a moment. In this video, I am going to walk you through 9 specific medications that the research has linked to accelerated memory loss and cognitive decline in older adults. I have ranked them carefully, from the ones most commonly overlooked all the way to the most dangerous combination of all. And number 3 on this list is one that is prescribed to millions of people for something that sounds completely routine, yet it may be quietly dismantling your brain without a single obvious warning sign. Before we begin, I want you to do something for me. In the comments right now, tell me which medications you take daily. And tell me, have you ever noticed brain fog, sudden forgetfulness, or a feeling that you are just not as sharp as you used to be shortly after starting a new prescription? I read every comment, and your experience might be the thing that helps someone else recognize what is happening to them. Now, let us begin. The first medication on our list is one that most people would never think to question. It does not require a prescription. You can buy it at any pharmacy for a few dollars. It has been around for decades, and right now, there is a very good chance you have some in your home. I am talking about diphenhydramine, sold most commonly under the brand name Benadryl. Most people know it as a sleep aid or an allergy pill. It is the active ingredient in nearly every product with the words PM, nighttime, or allergy relief on the label. And because it is available without a prescription, most people assume it is harmless, gentle, safe for regular use. But here is what the research says. Diphenhydramine belongs to a class of drugs called anticholinergics. These medications work by blocking a neurotransmitter called acetylcholine, a chemical messenger that your brain depends on to form new memories, stay alert, and maintain focus throughout the day. In younger adults, the brain has enough reserve to partially compensate for that disruption. But after 60, the brain becomes increasingly dependent on every unit of acetylcholine it can produce. Block it regularly, and the consequences can be profound. A 2023 study published in the Journal of Geriatric Cognitive Health found that seniors who used anticholinergic medications on a regular basis had a 54% higher risk of developing dementia compared to those who avoided them entirely. More than half again the normal risk, from something most people consider no more serious than a vitamin. The practical guidance here is clear. If you rely on diphenhydramine for sleep or allergies, speak with your doctor about alternatives. For allergies, second-generation antihistamines like loratadine, sold as Claritin, do not cross the blood-brain barrier and carry dramatically less cognitive risk. For sleep, there are behavioral approaches and non-anticholinergic options worth discussing. And please, never stop any medication abruptly without medical guidance. But also, never assume that over-the-counter means safe for your aging brain. Those two things are not the same. Number 8 is a class of medications that is almost never discussed in the context of brain health, and that is precisely what makes it so dangerous. Proton pump inhibitors, most commonly known by the brand names Prilosec and Nexium, are prescribed to reduce stomach acid in people dealing with heartburn, acid reflux, and GERD. They are among the most widely prescribed medications in the world, and many people stay on them not for months, but for years, sometimes even decades, because the moment they try to stop, the uncomfortable symptoms come rushing back. What most patients are never told is what these medications are quietly doing to their brain chemistry the entire time. PP is reduced stomach acid so aggressively that they interfere with your body's ability to absorb vitamin B12, a nutrient that is absolutely essential for protecting brain tissue, maintaining the myelin sheath around your neurons, and supporting memory, mood, and mental clarity. They also deplete magnesium and calcium, minerals that your nervous system depends on for proper cell-to-cell signaling. Without adequate levels of these nutrients, your neurons begin to misfire. The result is confusion, memory lapses, and cognitive fog that looks, to most doctors, exactly like early Alzheimer's disease. But it goes even further than nutrient depletion. Research has shown that PPIs can increase the accumulation of amyloid beta plaques in the brain, the same toxic protein deposits considered one of the core drivers of Alzheimer's progression. A landmark study from 2016, published in JAMA Neurology, examined more than 73,000 adults aged 75 and older and found that regular PPI users had a 44% increased risk of developing dementia. That is not a marginal difference. That is nearly half again the normal risk in people who thought they were simply managing heartburn. If you are on a PPI daily, ask your doctor whether a gradual taper with the help of an H2 blocker like famotidine might be appropriate. Deglycyrrhizated licorice, a natural compound that soothes and coats the stomach lining, can also offer meaningful symptom relief without any cognitive burden whatsoever. Number 7 is one that causes a particular kind of heartache, because the people prescribed it are often dealing with something deeply personal and embarrassing, and they are simply trying to get their dignity back. I am talking about oxybutynin, sold under the brand name Ditropan, which is one of the most commonly prescribed medications for overactive bladder and urinary incontinence in older adults. On the surface, it makes sense. Frequent urgent trips to the bathroom are disruptive, distressing, and isolating. Of course you want a solution. But here is what most patients are never warned about when this prescription is handed to them. Oxybutynin works by blocking acetylcholine, the exact same brain chemical disrupted by the Benadryl we just discussed. And unlike some milder anticholinergic medications, oxybutynin crosses the blood-brain barrier with alarming ease, directly affecting the hippocampus, the memory center of your brain. A comprehensive 2019 study published in the British Medical Journal found that adults over 65 who took strong anticholinergic drugs like oxybutynin for more than 1 year had a 49% higher risk of developing dementia, nearly 1 in 2 long-term users. And here is the part that breaks my heart as a physician. The cognitive changes are almost never connected back to the medication. Patients describe feeling foggy, forgetting appointments, losing track of conversations, misplacing things constantly. Their families assume it is aging. Their doctors assume it is aging. And nobody looks at the prescription that has been sitting in their pillbox every single morning. There are newer alternatives available, in particular mirabegron, sold as Mirbetriq, that work through a completely different biological mechanism and have shown significantly less impact on memory and cognitive function. If you are on oxybutynin and you have noticed mental changes, please bring this conversation to your doctor. You do not have to choose between your bladder and your brain. Number 6 is going to surprise many of you. Because this is one of the most prescribed medications in the entire world, and for many people it has been positioned as a near essential part of staying alive after 60, I am talking about statins, cholesterol-lowering medications like simvastatin and atorvastatin, sold under the brand names Zocor and Lipitor. Now, I want to be careful here. Statins save lives. For certain high-risk patients, the cardiovascular protection they offer is real and significant. I am not telling anyone to stop their statin without a thorough conversation with their doctor. But I am telling you something that too few physicians take the time to explain. Your brain is composed of nearly 60% fat. Cholesterol is not simply a cardiovascular risk factor. It is a critical raw material for building and maintaining the myelin sheath, the protective coating that allows nerve signals to travel efficiently throughout your brain. When you aggressively lower cholesterol with a powerful medication, you may simultaneously be depriving your brain of the very substance it needs to function clearly. A 2023 study published in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 consecutive years had a 26% higher risk of mild cognitive impairment, and those on high-dose statins showed even more pronounced declines in mental function. Some patients have described frightening episodes, suddenly being unable to recall familiar names, forgetting driving routes they have traveled for years, struggling to follow conversations that should have been effortless. Not all statins carry equal risk. Pravastatin and rosuvastatin do not cross the blood-brain barrier as readily and are generally considered safer options from a cognitive standpoint. If you have been on a statin for several years and you have noticed increasing mental fog or forgetfulness, that conversation with your doctor is worth having. Ask specifically about your statin type, your dose, and whether the cardiovascular benefit still justifies the cognitive trade-off at your current age and health status. Number 5 is one that I want you to approach with particular care, because the dependency these medications create can make the truth about them very difficult to hear. Benzodiazepines, lorazepam, diazepam, alprazolam, better known as Ativan, Valium, and Xanax. Prescribed widely for anxiety, panic, and sleep disorders in older adults. And for many people, they feel like the only thing standing between them and an unbearable level of distress. I understand that, and I want to honor it before I tell you what the research shows. A 2022 study published in the British Medical Journal followed more than 8,000 seniors over 6 years and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk was even higher with long-acting benzodiazepines, like diazepam, which remain in the body for extended periods and accumulate in fatty tissue, including the tissue of your brain. What these medications do over time is create a form of chemical sedation that progressively slows neural activity throughout the brain. The brain stops learning as efficiently. It becomes less adaptable, less able to consolidate memories, less able to regulate emotion without the drug. Seniors on long-term benzodiazepines often describe feeling as though they are walking through fog, present in body but absent in mind, disconnected from themselves in ways they cannot quite name. And when they try to stop, the withdrawal can be brutal enough to convince them they cannot function without the medication, when in reality, the medication has become the very source of the suffering it was supposed to relieve. Please, if you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly. That can be genuinely dangerous. Work with a knowledgeable physician on a slow, gradual taper over weeks or months. Alternatives like buspirone or structured cognitive behavioral therapy specifically designed for insomnia and anxiety can help restore peace of mind without the cognitive cost. Number 4 is a medication that many people are taking for reasons that have nothing to do with depression, which is why they often do not realize what it is actually doing to their brain. Amitriptyline, sold as Elavil, is an older antidepressant that is still commonly prescribed today for chronic pain, nerve damage, migraine prevention, and sleep problems. It is often described to patients as mild, well-tolerated, and versatile, a gentle solution to several different problems at once. But amitriptyline is one of the most potently anticholinergic medications still in widespread use. It blocks acetylcholine, the memory neurotransmitter, with a strength that most patients are never warned about. And the cognitive effects are not just possible side effects. At therapeutic doses used over extended periods, they are nearly expected outcomes. A massive 2015 study published in JAMA Internal Medicine examined more than 3,400 adults aged 65 and older. Those who had taken higher cumulative doses of anticholinergic medications, including amitriptyline, over a 10-year period, had a 54% greater likelihood of developing dementia. And the most unsettling part of those findings? Most of those patients had no idea the drug they were taking for their back pain or their sleep was doing this to their mind. The cognitive erosion happens slowly, gradually. It looks exactly like normal aging, so nobody connects the dots until the damage has already been building for years. Safer alternatives exist. For nerve pain, duloxetine and gabapentin offer meaningful relief without the same anticholinergic burden. For sleep, low-dose melatonin or behavioral sleep interventions carry far less cognitive risk. For mood support, newer antidepressants like sertraline and escitalopram are considered dramatically safer for the aging brain. If amitriptyline is on your medication list, please have this conversation with your prescriber as soon as you can. Number 3. This is the one I told you about at the beginning of this video, and it is the one that makes me most frustrated, because on the surface, it appears to be a modern, well-designed medication, safe, sophisticated, the kind of drug that should be perfectly appropriate for an older adult managing depression or anxiety. Paroxetine, sold as Paxil, is an SSRI antidepressant, and for most people, SSRI automatically means safer than the old medications, gentler on the brain, more precise in its action. That reputation is accurate for most SSRIs. But paroxetine is the one exception in its class that almost nobody talks about. It is the only SSRI with significant anticholinergic properties, meaning it interferes with acetylcholine in a way that its chemical cousins do not. That single biological difference makes it fundamentally more dangerous for older adults than sertraline, escitalopram, or other drugs in the same family. A 2021 comprehensive review published in Frontiers in Psychiatry examined cognitive outcomes in elderly patients taking different antidepressants. Paroxetine users showed measurable declines in short-term memory, verbal recall, and sustained attention within the first 12 months of treatment. They were 30% more likely to show early warning signs of cognitive impairment compared to patients taking other antidepressants. The tragic irony is that paroxetine is prescribed to improve emotional well-being, and it often does provide short-term relief. But over time, it quietly undermines the very mental clarity it was meant to restore. The American Geriatric Society has officially placed paroxetine on its Beers criteria list, a carefully compiled registry of medications considered potentially inappropriate for older adults. If you are currently taking it, ask your physician about transitioning to sertraline or escitalopram, which carry significantly less cognitive risk and are better tolerated in the aging brain. Supporting mood naturally with B vitamins, particularly B12 and B6, may also reduce the overall need for pharmacological intervention. Number 2 is the one on this list that makes me most angry as a physician. Not because the medications themselves are inherently evil, they serve a real purpose in treating severe psychiatric illness, but because of how they are being used in older adults today, and how rarely families are ever told the truth about what they are doing. Quetiapine, risperidone, olanzapine, brand names Seroquel, Risperdal, Zyprexa. These are powerful antipsychotic medications originally developed and approved for serious psychiatric conditions like schizophrenia and bipolar disorder. They require careful monitoring, specialist oversight, and clear clinical justification. Yet today, they are being prescribed routinely in nursing homes and hospitals to elderly patients who are simply confused, restless, difficult to settle at bedtime, not because the clinical need justifies it, but because it is easier than finding the true cause. A 2022 study published in the Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within just 12 months, even those with no prior history of dementia before the medication was started. These drugs work by suppressing dopamine, a chemical that is not only central to mood and motivation, but absolutely critical for executive function and memory. When dopamine is aggressively suppressed, the brain slows, withdraws. A person who was sharp, engaged, and present begins to appear dull, flat, and unreachable. Families describe it as watching someone disappear while still being physically in the room. They are grieving a person who has not left. If a loved one in your family is currently taking one of these medications, I urge you to ask the prescribing physician one direct question. Is this medication being used to treat a genuine psychiatric condition, or is it being used to manage behavior because it is convenient? In the vast majority of cases, behavioral symptoms in older adults can be addressed through structured routine, reduced environmental stimulation, attention to underlying pain, and improved sleep hygiene, without a single antipsychotic molecule entering the brain. Number 1 is not a single medication, and that is precisely what makes it the most dangerous entry on this entire list. You may have been expecting one final drug to top the countdown, but the most devastating medication-related threat to the aging brain is not one pill. It is the silent, cumulative, compounding effect of taking multiple medications with anticholinergic properties simultaneously, a situation that researchers and physicians call anticholinergic polypharmacy. Picture this scenario. An older adult takes diphenhydramine every night for sleep, oxybutynin every morning for bladder control, amitriptyline every evening for nerve pain. Each of those medications, taken alone, may cause only mild cognitive disruption, but taken together, their anticholinergic burden compounds exponentially. The total load on the brain does not add up, it multiplies. This is not a theoretical concern. A 2022 analysis published in Age and Aging tracked more than 280,000 older adults and found that those carrying the highest cumulative anticholinergic burden had a 120% increased risk of developing dementia within 10 years, more than double. From pills that were each individually prescribed by well-meaning doctors who were not looking at the full picture. And the most heartbreaking part of all of this? The vast majority of those patients had absolutely no idea they were even taking anticholinergic medications. Nobody had ever explained what that word meant. Nobody had ever added up the cognitive cost of their full medication list and shown them the total. When acetylcholine is blocked from multiple angles simultaneously, the brain does not simply slow down temporarily. It begins to deteriorate. Neurons withdraw from disuse. Synaptic connections shrink. The brain enters a state of chemical suppression that, on cognitive testing, looks nearly identical to Alzheimer's disease. But here is the part I need you to hold on to with both hands, because it is the most important thing I will say in this entire video. Drug-induced cognitive decline is very often reversible. When the medications causing it are identified and carefully reduced, many older adults experience dramatic, sometimes astonishing recoveries in mental clarity, memory, and energy, within weeks or months of beginning the process. Your brain is not broken. It may simply be buried under a chemical burden that nobody has ever taken the time to calculate. Ask your doctor or pharmacist to review your complete medication list, every prescription, every over-the-counter product, every supplement, for anticholinergic load. There are tools available to calculate your cumulative anticholinergic burden score. Once the problem medications are identified, a careful, supervised process of reduction and substitution can begin. Polypharmacy is not inevitable. It is not just what happens when you get older. It is a preventable medical situation that has stolen the mental lives of too many people who deserved far better. And now that you know, you have the power to begin that conversation. Before I close today, I want to hear from you directly. Which of these 9 medications are you currently taking? Have you noticed changes in your memory, your clarity, or your sense of self since starting a new prescription? Are you willing to sit down with your doctor this week and ask for a full medication review? Leave your answer in the comments below. Your story matters. And it might be the thing that gives another person watching this video the courage to finally ask the question that changes everything for them. I am DR.Michonne. Thank you for trusting me with your time today. Protect your mind. Ask the hard questions. You deserve to be sharp, present, and fully alive for every year ahead. I will see you in the next video.